So tonight, I'm going to talk about really one model of development, and I'll do a couple models over the course of the 5 sessions. I will do a couple models of development, but this one is more related to seeing the kids as younger than they really are. And so when I say that we're going to talk about trauma-informed parenting, it's just an agreement that trauma impairs the ability of each of your adopted kids to move forward through normal stages of development, that part of them is younger based on when their trauma occurred or what the type of trauma was. And as many of you have learned by now, some of the more normal parenting techniques that you're used to using, like timeout or removal of privileges, do not work with these kids, that the trauma has impaired them in some way, that we need specialized techniques. Just like if you had a child with diabetes, you would need insulin and a change of diet and maybe some extra exercise. These kids need parenting techniques that will resolve the trauma residue and get you post-traumatic growth. And in this day and age, the definition of trauma that we use is this one on this slide. It's called complex trauma. It was created by a group of people at the National Child Traumatic Stress Network, and we've used it since they created it. And it's just that your kids have had early trauma. The trauma started prenatally. The trauma continued in the early part of their life, maybe just a few weeks or a few months. Maybe it was ongoing for years, but that the trauma was complex, meaning it was more than one trauma. It could be prenatal drug exposure. It could be prenatal exposure to stress or prenatal exposure to domestic violence, along with an abandonment, or after they were born, we have neglect, and then maybe we had a removal by children's services, or they were placed in an orphanage. Maybe they had more trauma there, malnutrition, failure to thrive, but that the trauma is multiple traumas starting early in life. The traumas are interpersonal. There was trauma in their relationship. The relationships didn't go well. In many cases, adults that were supposed to care for them did not. Maybe those adults were not even a source of safety. Maybe they simply perceived their trauma as overwhelming or unsafe or anxiety producing. And that this trauma interrupts their development. It interrupts their ability to attach. And so the model of development tonight is the one I'm most familiar with because I use it the most. I do believe that attachment is your year one task. When you are developing from birth to a year old, you're learning to attach to people around you. And if you don't get a good attachment, then your subsequent development is jeopardized. And by that, we mean your cognitive development, your social development, sometimes your physical development, your brain development, your social development. And your sense of self is often poor, or I don't want to say non-existent, but you don't have much of a sense of self. You may have a lot of the orphanage kids perceive themselves to be more a part of a group than a separate person. And so that skews then the way that they interact or view themselves in interactions. And for some reason, that slide is not advancing. There we go. Attachment facilitates subsequent development. And so in the first 2 years of life, you get what we call your foundational skills. So unbeknownst to many of you, you're bringing a child into the home who has a cracked foundation. Similar to if you had a house, if you bought a house with a cracked foundation, it would repair the foundation, and then you would paint the house and decorate the house. If you don't fix the foundation, then over time, the house would destabilize and begin to fall apart. For those of you who have kids who are at least 9 or older, you are more familiar with the types of declines, like you have kids who are going along and then Often 5, 6, you see a decline in their functioning. Maybe it's not too bad, but you notice they don't seem to be keeping pace with their peers. 9 to 11, we often see a bigger decline when the brain has to begin to really advance the executive functions. If we don't see it then, you're going to see it right around 14. And at 14, we often see a very big decline. That is the age at which most kids come into therapy. That is the age at which more adopted kids are psychiatrically hospitalized than any other group. And that is also the age at which we see more adopted children comprise the juvenile detention population. Can be a serious decline. So the foundational delays that I think you all see are the ones I have listed here. I think you have kids, and I'm going to focus on the cause and effect thinking tonight, the problem solving skills, the moral development. I think they cause a lot of the day-to-day struggles that you have. Probably the most struggles come from a lack of those skills, but they don't learn from their mistakes. They do the same thing over and over and keep trying different things, but you're not really able to get them past that. Their solutions are very poor. They argue, maybe they run away. Instead of facing up to their problems, they lie. Instead of accepting responsibility, making their problem twice as big. But in some way, they don't have problem solving skills that allow them to generate solutions that are effective. Many of the kids you live with and the kids I work with don't have solid empathy, and they don't then make decisions that take others into account. Their mood regulation is very poor. They don't identify, express, or regulate their emotions. Everybody that's on this screen tonight has experienced large temper tantrums. Their social skills lag behind their peers, very difficult for them to make and keep friends. They're not reciprocal. You give and give and give. They tend to take and take and take, but they give very little back until we really begin to, kind of make them do that in some ways to the best of our ability. They don't always trust you, so they don't always listen to you. They don't have good respect for you as people, or sometimes their teachers or others. They want things immediately. They're very impulsive. They're very concrete. They don't move on to abstract thinking as in a timely manner, and many stay concrete thinkers well into adolescence. It would be very rare for me at the office to use any type of like analogy, or they're not analogies, but I learned a long time ago not to say things like, oh, it's raining cats and dogs, or everybody runs to the window to look at the cats and dogs. They're very literal. Once I said to a kid something about having sticky fingers, and he began to proceed to argue with me that he had washed his hands, and I meant that he had been stealing again. And so finally I had to say to him, okay, let's just move on from the sticky fingers. I shouldn't have said it. Or I don't say things like you've got yourself into a pickle, or they'll be looking for the pickle. And I think most of you who experience kids who have very little initiative or motivation. And those are the skills that should set in place. They should all be set in motion, well into motion by the age of 2. And then they should just keep refining themselves and getting more sophisticated from there. So if you're recognizing those delays, those are the kinds of things that we need parenting strategies that will move that development along so that your kids mature and become easier to live with and easier for other kids to relate to. You can ask questions anytime you want to. You can stop me at any point you want to. But out of mature development, you all know you have behavior problems, and this particular group has an array of behavior problems. Anything from, overeating to pee and poop issues, to just living with kids who won't pick up after themselves, kids who don't sleep well, some kids who are moving into worse behavior, substance abuse, pornography, social media kinds of problems. They're oppositional, they like to argue. They'll argue to the death. as I say sometimes. And really what sometimes begins to happen is they're able to actually kind of make the dynamics of your home like the dynamics of other homes that they have moved out of or orphanages. You find yourselves getting angrier than you ever thought was possible. So I'm kind of, tonight, I just put up the cognitive domain of development. So I said, I'm going to take a cognitive skill and show how it relates to the social skills and how we can get some of the cognitive skills going. But in the cognitive domain of development, these are all the skills that we're looking for kids to develop, where their trauma gives them irrational cognitions. And most of you know a lot of what they think because we've discovered a lot of that in therapy. They don't have a lot of curiosity and initiative. You get the I'm bored chronically, or they just sit, they don't do anything processing new information. We're looking at their QEEGs, how their brain looks, to see how their brain is processing information, seeing if we can influence with some brain therapies. Focusing and completing new tasks is very difficult. They're very hypervigilant. Most of them have an underlying anxiety. Cause and effect thinking is a big issue. Most of the people in this room have kids that at least have object constancy. They know that if you go out to the garage, you're coming back. There are other clients I work with who really don't understand that when you're gone, you're going to come back, and they follow you all around, all over the house. They're standing outside the bathroom door. When you're going to the bathroom, they basically fall into the bathroom when you open the door. They don't have a good sense of time or themselves in space. Lots of learning disabilities that you're working on at school with your IEPs. And again, the abstract thinking, which is very difficult. It is very difficult to be a person without abstract thinking. It's very difficult to live and work with concrete thinkers. They are black and white. It's black and white, mean or nice, good or bad. They do not see the gray areas, and that can make life very difficult for everybody. This continuum right here, development is like a set of gears. Social development, emotional development, physical development, and cognitive development are like 4 gears. They should all be turning. They should all be moving forward, advancing skills. And for the most part, you could say that development happens in stages. There's other models of development. As I said, I'll put a couple of those forth later on. I like the stages of development. I do use that as my predominant model. I'm looking to advance kids through various stages of development. This particular continuum right here, I think, is the one that really causes the majority of problems in the adoptive home. If I had to pick a few pieces, if I have triage kids coming into therapy, I say, okay, well, if we could get this moving and we could kind of get that emotional regulation under control, then other skills would begin to fall into place. So it's really just like if you're an infant, you're going to learn to pick your head up, you're going to learn to roll over, you're going to learn to sit up. Pretty soon you're going to learn to stand up, and pretty soon you're going to learn to walk. You've passed through a series of stages. Well, truthfully, in order to get to higher level moral development and social skills, you have to have cause and effect thinking first. And even before that, you could say there's a sequencing kind of process that goes on. If in year 1 of life, if you cry and you have a good parent, nurturing parent, a psychologically present parent, then the parent comes, gives you a bottle, changes your diaper, whatever, and you go, oh, that makes me happy. And you see this sequence repeating itself over and over and over. And by the time you're 18 months old, you've got some rudimentary cause and effect thinking, out of which comes your problem solving skills. Some people are calling them coping skills, and I think that we're even moving to calling them critical thinking skills at this point in time. So whichever of those terms you're familiar with, you use whichever one you want. Once you have cause and effect thinking and problem solving skills, then you get good moral development. You have empathy, and you have genuine remorse. And then you can have good social skills, because now you can see yourself in relation to others and decide which actions you should take and which ones you should not. And many of your children do not look at themselves in relation to others. They really just basically do what feels good to them. They're really kind of stuck at what I call a pre-conventional moral development, which is the moral development of a 2-year-old. And that development is, I want it, I take it, and I don't really understand why you're so upset about it. That's why when they say I'm sorry, it's much more of a sorry. It's not a real genuine sorry, because they don't really feel like they've done anything wrong, or they don't really understand why you're upset with what they did. And then I just did a few slides of solutions, which we could do if you would like. I could keep talking and go through that, and then we can do discussion, or you can ask questions as I go along here. So here are just a few questions that I ask myself all the time. I make sure I'm not thinking. I try not to do any thinking for any of the kids I work with. And so I think it's good to self-assess, to just take a week or 2 weeks and say, how much thinking did I do for my son or daughter today? And what are the ramifications of that? How are they going to learn to think if I keep doing it for them? What are my reasons for doing their thinking? And what would happen if I stopped? I think a lot of people are kind of afraid to stop.
Get into a bad habit.
You're in a bad habit. You just keep doing it because it's a habit now.
Mhm.
Is what you mean? Like you're talking about, like just
Some of the reasons that's a habit. You're trying to get things going throughout the day, and instead of the kid taking initiative, you're taking the initiative, and you get stuck in that pattern.
I think that's true. I think you don't. I think it becomes. I think because this goes on for so many years. I mean, it's not like, if you reminded a typically developing child to take their backpack a couple of times, they'd start taking their backpack on their own. These kids, you can remind them for 10 years and they're still not taking their backpack as they're leaving the house. And so I agree with you. I think part of it just becomes a habit. Get your backpack. Did you eat your breakfast? Is your homework in your backpack? Did you brush your teeth? Did you? Right. And so in your case, you would want to work on trying to break that habit. Sometimes I think some of you just get busy and are trying to get them out the door, or you just want to make sure they're out the door so that you can then just kind of sit down, go, oh my gosh, that's over. Like they're gone for 6 hours. The yellow bus came, thank goodness. And we're good to go now for a while. I think as some people are nodding their heads like, oh, yeah, I was happy to see the yellow bus come. Sad when May comes. What did you say?
I was just going to say, I thought that for a long time that if I did those things and thought for him that he would that I was saving him. I know that sounds really like narcissistic, but I thought that eventually if I could just keep him up here, that eventually it was like a gear, and I was in my head, I was like, eventually his gear will catch,
right,
and then he'll be able to launch. I know that sounds dumb, but that's what I thought I was doing for a really long time.
Yeah, I don't think that's dumb. I think that's what a lot of people, I mean, nobody wants their child to fail. And you are hoping that like, how long is this going to take? When are they going to get going? And pretty soon they're 14, 15 years old, and we're still in the same boat we were in when they were 6, 7, 8, 9. Right. You can remind them for years. I mean, I probably get more phone calls from people who have kids ages 19 to 25 than any other group of people other than 14. And they're saying like things to me like, okay, now we're getting him up to go to work. Now we're making sure like he's got his lunch to go to work, like we really want to get out of this pattern. What will we do? And so, because the reality is setting in that now this kid isn't even going to be able to move out and be functional. And so, right. And so, I'm happy for all of you that you're getting services now, because by the time they're 19 to 25, they have to agree to participate in services. And that's often very difficult to get them to see at that age that they have significant problems. At that point, they're pretty happy to just live in your house and let you keep waking them up to go to work. And you're still doing their laundry, or, and they're still eating. So they're kind of happy that way. So those are some questions we can think about, because my next slide is a little, I think, well, maybe one more. No. So if I do, oh, no, go back. So I have to get you guys out of my way a little bit. I'll put you over here. Okay. And I think the other one we have to think about is, I call it thinking about a New Year's resolution. Every year I make my wonderful resolution. I'm going to eat a better diet. I'm not going to drink so much coffee. I'm going to, stop eating at fast food places so much. And by January 10th, I'm driving through McDonald's, getting my 2 cheeseburgers, my large chocolate shake, my large fry, while I have a coffee in the coffee holder as well. And, you have to ask yourself, how many behaviors am I asking my child to change at one time? Because most of us can only change 2 or 3 behaviors. And that's with us really working at it. And kids with poor coping skills, that's going to be about maximum if you're going to try and change 2 or 3 behaviors. I prioritize aggression. Sometimes if I'm working on aggression or bigger temper tantrums, kids that tantrum 2 or 3 hours at a time, kids who are throwing things, that kind of behavior. If they're older and the stealing is really becoming, where it's getting to somebody's going to call the police, because they're not really, some of our client kids are no longer leaving anybody a choice. They're stealing items of value, or they're stealing from stores, and they're starting to get in that kind of trouble. So depending on what I see when I take a case, I would prioritize anything that's really going to jeopardize their placement in the home, or things that are going to really jeopardize their future, in my opinion. So it's usually the aggression, the mood, throwing things, stealing, and then some of the social media stuff that I think is very unsafe. And so I ask everybody, pick battles. If we don't have, if we get those bigger things under control, then what either annoys you, what's most impairing their functioning during the day, what are a couple battles there that you want to deal with, and then we'll go about seeing, if that's feasible. I think there are some battles you can't win. Pee and poop is very hard to win, and food is very hard to win. And typically, if you mess with food, you get more pee and poop. And typically, if you mess with pee and poop, you get more food issues. Or we toy with food a lot, then we get them going through other kids' lunches, or we just get them flat out. I can't tell you how many clients I've had over the years who in the cafeteria are just going from table to table asking other kids if they're going to be finishing what's on their tray. And if not, they'd like to have it. And that does not win them many friends, and teachers find that very odd. And they wonder if you're actually giving them food at home. So it depends on, what we think we can win reasonably without creating like maybe something else. Here is what I really think we all need to work on. This is we are not the Borg. We are not from Star Trek. We are not all conjoined at the brain. Everybody in the family has their own brain. Some brains just work better than others. But I would really like to see effort. And here I'm going to take away like your 4 favorite parenting tools: threats, reminders, warnings, and bribes. People are laughing. Some people with panic, like, what will we do if we stop doing that? We can let things take their natural and logical course. We can let them go to school hungry. I don't really care if their clothes match. We can just let them I was just looking at the chatting. I don't see. Okay. It's not telling me, for the person who chatted with me, it's not telling me anybody's trying to get in the waiting room. So nobody's there yet. But I don't care what they wear to school. I don't care if it matches. I've had kids come to the waiting room in their pajamas. I don't say one word. I think they would like me to, why are you in your pajamas? Oh my gosh, it's 4 o'clock in the afternoon and you're in a public place. Well, I don't say anything. I just do therapy with them in their pajamas. I don't care if they have their backpack. Now, some of that depends on what you think the school might think. If you think the school would fuss that they don't have their backpack, then by all means, give them their backpack. But just give it to them. Don't have a big battle over it. If you want to give the school a heads up, little Bobby's coming in his pajamas today. I stuffed a pair of pants and a shirt in his backpack. If you want to try and get him dressed, that's fine with me. I don't do threats. It's rare that I might slip once in a while, and then I catch myself and I try and regroup from it. I think when you say, if you don't do this, you're going to lose all your privileges, I really feel like you've done all the thinking for them. Now they know exactly what's going to happen, and many kids will make a choice out of that. They will choose to just lose their electronic privileges for a week rather than get their room cleaned or get in the car or whatever. So I don't do any threats. If I want their room cleaned, I just don't say anything. They'll either clean it or they won't. And then I have the option of going in and just anything left on the floor, I just pick it up and remove it. It's mine now. And they'll have to figure out how to get it back for me. I've just learned to be very quiet. And I either pick the battle or I don't. And if I pick the battle, I just take an action. I say very little. And I've just worked at that. When I moved to Ohio to work for Dr. Cack 20 some years ago, I didn't know any of this parenting. And so I would just watch the other therapists, see what they were doing. And then I would make little notes in my head. And then I would come home and make myself Post-it notes. And I look at my Post-it notes every day before I left the house and say, this is what I'm working on. I'm working on being quieter. I'm working on taking action. I'm working on joining in, or I'm working on paradoxing, or whatever I was working on. And gradually over a period of time, I just learned the parenting. And so I do encourage people to, pick something. Do you do a lot of reminders? Could you stop some of those? What would happen if your kids went without stuff? What do you think would happen? Would the school call you? Would you feel like a bad parent? Would you?
I'll jump in.
Go ahead.
So actually this morning, since I'm here for I have to work from home because of circumstances right now. And when my son was getting ready for school, he took his medications. He didn't want cereal. I said, okay, you do what you want to do. Just remember, please leave the house at 8:15 to catch the bus. And as I'm talking with people, as one of my patients, I'm looking out the window to make sure he's not getting kidnapped because he has to go to the corner.
Right.
And let me tell you, and right before that, all of a sudden I could hear him like yelling, and I'm like, what's going on here? So I went out there. I said, what's going on? He goes, I keep forgetting to get the stuff I need to take with me to school. And he grabbed everything and he left.
Oh, good.
I was very happy to see that whole sequence unfold right there. It is the first time
Very
where
good.
he was panicking, going, oh my God, I need to get my stuff ready. And he did.
Good job. I'll get you a little gold. You'll get a sticker for that. I'll send you a little sticker. Anybody else? Just try stopping telling them things.
I'm working on that. As you know, I'm overly done. But I would say that there's a lot of pressure when they're like in between that age, when to me, the hard age was like 13 through maybe 14, 15,
Mhm.
when you feel like they should be responsible to do stuff, but they're not doing it. And then I do feel like there's a lot of, at least I feel like there's a lot of scrutiny from other parents that your kid would look weird, or that the teachers would have an assumption about how we were raising our kids. And so I felt like I was working hard to cover that up.
Right.
And now that I have an older son, I don't feel as bad, because I think people get that, like, we're working on, like, you know, they've got to figure that out, because I don't want a 19-year-old that can't wake up for work.
Right. Because his
But
problems more, I think
right,
problems are more obvious now.
right. But I also feel like there is that scrutiny from parents and teachers, that it's hard to feel like you know what the right thing to do is, because if they're constantly not showing up with their backpack, or like this gentleman said, you know, then you feel like you're being judged as a parent because you didn't have what they needed for school.
Mhm. Right. And I think it's kind of, I mean, it's really, they didn't have what they needed for school. Really, by the time you are 6, you are able to brush your teeth and get dressed. And you really are able to actually either grab your lunch and your stuff you need, or you're able to actually pack your lunch and take the stuff you need. So anything, when we're getting past 1st and 2nd grade, if we're still reminding, warning, threatening, or bribing, we really can begin to slow that down or stop it, and we'll just let them begin to forget stuff. And I think if, I mean, you know, I don't know, I was a foster parent for a long time, and I'm sure when Dr. Keck hired me and I moved out of my neighborhood, there was probably some celebration that that kind of lunatic was gone, and those, you know, nobody, you know, really tried to understand what I was accomplishing. And so I think you're right. I think you do get judged. But if it was, I think I do encourage people to kind of try and move beyond that, because you really are the people who are going to get the brunt of this if they don't learn some sense of responsibility. You're going to be the one the police are calling. You're going to be the ones, you know, going to the psychiatric hospital. You're going to be the ones really struggling through the crisis periods. And other people are not, you know, really going to be there like you are going to be there. And so I try and shed, you know, what do other people think of me? And try and get this development moving forward. If I really want to get cause and effect thinking moving, then I have to allow them to forget things. And I really feel like if I listen to what Peter just said, I do feel like the times I've allowed kids to just forget stuff or fail or whatever, they've not done it again. When I was at the office full time before COVID, kids would leave library books, school books, electronic devices. And I had a firm, fast rule. We did not run out to the car after anybody. You drove off without it. Appointments are every 2 weeks. And so if they chose to call me in that 2 weeks and work something out with me, if they were going to pay me for the postage or for whatever, they might get me to go to the post office and mail it back. But again, they were going to have some natural and logical consequence for that. I'm not going to go mail it for free. Or you could just wait. And the kids that just waited, like, asked me for it the moment they set foot in the building. There was no, hi, Miss Arlita, how it's, do you have my iPod? Do you have my iPod? Do you have it? Do you have my iPod? I'd be like, well, hi, how are you today? How's it go? How's school? How's it going? Yes, I have your iPod. And then they would stand there, and then I would walk away with their parents, and then they would follow. What, do you have it? Yes, yes, I have it. Oh, and then they'd follow a little bit more, and then they'd stand there. Never did they ask me, could I have it? So I just went with the parents in my office, shut the door. They were standing out in the waiting room. Sometimes they just stood there. They couldn't figure out what to do. But at the moment at which they finally figured out they needed to ask, could I have it back? Do you have it? I would say, yes, you may have it back. There you go. Because I want them to figure out the whole cycle that you have to ask for things. Because most of you know your kids come and stare at you if they want something. Or they come
We
and
had
I'm
that.
thirsty. I'm thirsty. I need blah. You know.
Yeah.
Right.
We
Go
had
ahead.
that today, Arlita. We made some Rice Krispie treats. And my youngest, 5-year-old comes up, can I have some? Can I have some? It's like, it's almost up, or just a little bit.
Mhm.
Then my 11-year-old comes and just stares at me. It's like, all he had to do was ask. And
Yes.
he would not ask.
And people start, and usually what happens is people start guessing. Oh, did you want a Rice Krispie treat? Did you need help with your homework? Oh, did you need, at the office, I used to keep there's a kind of an upscale grocery store across the street from the office, and they always have those designer fruits, I call them, the dragon fruits, the weird things, kiwi, things that kids don't see as often because they don't want to eat fruit, God forbid. But and so I would just keep a couple of those. And when they came and stared at me, I just handed them like a tomato or a kumquat and I walked away. And they would stand there holding whatever I had given them. And often when I was done talking to their parents and I went to get them, they were still sitting in a chair holding whatever I had given them. And usually after 3 or 4 appointments, they finally figured out that they had to actually ask me, next session, we'd go through, I need a stapler. Oh, thank you for letting me know. I'd close the door. 2 minutes, there'll be a knock at the door. I need a stapler. Oh, yes, you mentioned that. Thank you for letting me know. Pretty soon, bang, I need a stapler. Yes, I know. Thank you. If you let me know that, thank you. And then your session 3, there was usually some other strategy. And then finally session 4, it was, may I have a stapler? May I have a pencil? May I have? They would finally learn, and that's kind of not being, in the Star Trek, they call it being part of the collective where everybody's using one brain, and we want to move out of the collective. I want them to get thinking about what they're doing, how they're relating, and how they need to be relating. And, for some kids, that would take 2 or 3 months. But it's worth the wait when you finally get it. And then you have to hold firm.
Yeah. It's hard in that moment to
Right.
stick with it. When you see how bad they want it and you feel how much you want to meet that need,
Right.
it is so hard to just not give in.
Right.
Yeah.
So then I want you to think about how hard it is to live with that behavior.
Yeah.
And say, no, I'll keep the Rice Krispies treat. That's okay. No, I want to get out of this situation. I don't want to live like this anymore. Really, if you can get some level of cause and effect thinking, 80% of your behavior problems will go away because they will be thinking more about what will happen if I do this. And that's really the point I want everybody to get to. And so if I could wave my magic wand and say there was one thing that I think would make a big difference, it would be less talk, more action with these kids. And I wrote on this slide to resist the urge to manage by device. It's okay. I mean, if you remove their phone because they weren't using it correctly, that is the natural and logical consequence. To remove all their privilege, to remove their electronic device because their room isn't clean is not really natural and logical. I mean, we have to find a natural and logical consequence that goes with not cleaning your room. There's a natural and logical consequence to most things. There's not a natural and logical consequence to all things. I can't guarantee you that if you call me or email me, I can give you a natural and logical consequence for every single thing. I can give it to you for most things. So that's my little talk there. If I was going to pick one slide for everybody to work on, it'd be this one right here. That's just
I was
yeah.
just gonna say, I teach at the school my sons go to.
Yes, we're in a hard situation.
Yes, it's great to have some of these things happen with to your coworkers and it's your child. But I just was going to make sure that everybody tells their teacher, or if you don't, I think it's a good idea to let them know, of course, what's going on. And if they're coming in their pajamas, whatever, let them know, because I think most teachers are more than happy to work with you.
Yes.
but it is a catch-22. I don't want my kid to fail school, so I do, want to remind him to get his backpack, but it's just going to have to be that way. And I have even told the teacher that really this stuff that we're doing with you kind of comes before everything, and they're pretty on board with it.
Good. I think I do. I think a lot of schools,
Yeah.
right. I think if they know that's what we're working on, then they're more willing to let them go without that item for the day. And I really don't think most kids will do things more than 3 times. It's been my experience that they won't let themselves be hungry. I mean, if you're really worried about them being hungry, they can have a couple of I don't care if we put a couple of granola bars in their backpack. I don't want to starve anybody or interfere with anybody's true attention span or blood sugar level or anything like that. So a lot of times I'm happy to put a couple of things there that they could have when they got there. I am supportive of sneaking some clothes in their backpack so that if the school wants to dress them, that's fine. Because I think the point is made once they arrive in their pajamas, I think they realize how silly they look. So once the point is made, I don't feel the need to belabor it. If I've made my point, I just am quiet, then I'm done, I walk away. No, it doesn't that one. Sometimes. There we go. I think it's good if you have a picture of your child when they are younger, or you just put up a Post-it note that my child is younger than their chronological age. If you look at that list of core skills on that one slide, and we know that they all develop we know that they're well in motion by the time you're 2, then a lot of you are really parenting kids where a piece of them is stuck at 2 or younger. So if you have an 8-year-old, that's a 6-year gap. If you have a 12-year-old, that's a 10-year gap. If you have a 15-year-old, and that's why we see our adolescents really crashing, because that 2-year-old piece is no longer enough to sustain any level of functioning. And I can show you, I have one picture. This is on a different PowerPoint. And so I don't know if what can you see on your screen right now? Can you see a list of the top starts 7 years, 11 months, and then it goes 1 year, 11 months. Can you see that? I'm going to change my screen share. For a long time, we did developmental testing on all of our kids, so parents could actually hang up this breakdown if they wanted to. And then the test that we used was totally revised. It's been under revision for a couple of years. And I just bought the new version because it's now available. And I have to call them and find out if these conversions are still, you could convert their score into an age. And so it gave you the actual breakdown in these categories. Your child is 7 years, 11 months old chronologically, but their receptive language, what they're taking in, is functioning at 1 year, 11 months. Their expressive language is 6 years, 4 months. Trauma interrupts development and causes like this scatter. There's usually a core age at which they're stuck, and then other skills have fragmented forward. As much steam as the development can give them, they keep moving in some ways, and then they kind of just peter out and stop at certain points. Right there, this particular child was able to write like a 9-year-old. That, for whatever reason, was advanced. We do see that with some of our clients where, because it's more of a visual skill, it's a little more advanced. These kids tend to be visual. Their personal hygiene, their personal ability, this particular child to care for himself was pretty close to his chronological age. His ability to carry out chores around the house, 5 years, 5 months. Out in the community, he was a little superficial charming. He looked better. He was 7 years, 6 months. Interpersonal relationships, 1 year, 1 month. He's functioning like a toddler in relationships, and he was. No sharing, no empathy, no remorse, no real attachment to anybody. Starting to have, like stuck in temper tantrums already, kind of started tantruming early and never grew out of it. Play and leisure skills for 2 years, 9 months. So no real well-developed, no hobbies, no interests. Play was very much like a preschooler. And his ability to problem solve, to generate solutions, 1 year, 6 months. This was little more than a year later. He actually had some desire to get better. His parents, he was actually quite violent. They adapted to the parenting because they were kind of in survival. I mean, he either had to get better or leave the family. And then you can see the gains that he made. But these interpersonal relationships, it was very rare. We probably did 300 clients over the years that we did these Vineland adaptive scales. It was very rare to see anybody pass 3 in their interpersonal relationships, their play and leisure, and their coping skills. That real core relational stuff was very, very stuck. And so you really are dealing in many cases with kids who are very little at the core. And then they're perpetual toddlers. And that is why you're so exhausted all the time, because they never grow up. They never take on responsibilities. And so for me, the trauma-informed parenting is really one of the main ways. Therapy is nice and therapy is helpful. Neurofeedback is nice. Neurofeedback is helpful. Medications are nice. Medications are helpful. But really this day-to-day trying to get them to think is really, and trying to find ways to relate to them, to make connections with them. These are the ways we're really going to get this development going, and they're going to mature, and you're going to have a happier life, and they're going to be better. And then the whole family can do better. And if the Vineland, if they still have those conversion skills, I'll be happy to do those again for people that we've never done. So you could see there's a couple of people who are still in therapy at the time of that conversion. We could do a new one on your child, and I do plan to call them this week and see if that's going to be possible to still do that. The upgrade to the test was really pretty significant. So now I'm going back. But that's a good example of how little your kids, I think it was really helpful for people to see how little their kids actually were. You want to remind yourself that they're younger, and then you can adjust some expectations accordingly. Like, I don't lower my expectations, but I'm less angry about messes. I'm less angry about a bedroom that isn't clean. When I was a foster parent, I always had 3 kids. Saturday mornings, I used to take a 40-gallon garbage can up to the top of the steps, and everybody started bringing out their stuff. What needed to go in the garbage went in the garbage, but I didn't get mad about it. I wasn't nagging. It was just, this is the way we're going to do this. I wanted to just keep, I just wanted to keep the food from rotting out of the room. And I wanted to know if there was like clothes that had been urinated on. I wanted to keep the odor down. That was my big goal. But my expectation wasn't that these older kids, I had all adolescents, that they were just not going to go up and clean their room. They were not really old enough to do some of that kind of stuff. So I think if you can see them differently, then you're not as upset with stuff, or you find other ways to kind of take care of that battle while you're working on some other things. Maybe you're just not going to make that your battle. Let's move along here. Oh, I see. Because I didn't do this. Now it doesn't want to do what I want it to do. I think all of these kids do better when they have less stuff. Many kids, we have just boiled down to 7 outfits in their closet. And next week we give them 7 different outfits. I'm not trying to take their stuff away. I don't really care how much stuff they have. We're just keeping it more minimum on a day-to-day basis, and that way there's less to pick up. Toys can be in plastic buckets. You can play with these toys this week. Next week, I'll give you a different bucket, or you can keep the bucket you have. I really don't care. But you don't need 3 buckets of toys, because if you have 3 buckets of toys, you're just going to dump them all out. Lots of kids just make a big mess with their toys. They don't really play with them. If you come to my office, those of you who've been there, I don't have any toys in my office for kids over 5. And I do much better because they're more geared for younger children. And kids who are 12, 13, and 14 will build with those Legos. They love those Magnetiles, and they will sit in the waiting room and they will do that stuff because they are younger children. And so I'm a firm believer in mixing some young toys in, some things for younger kids to do all the time, and letting them play with that stuff. Because all of the younger age toys are designed to get cause and effect thinking. Fisher-Price toys are designed to help develop the task that's going with your age. Buy them at yard sales. Older kids will ruin little kid toys because they don't, I mean, all of you know, if you have older kids, they don't know this, they physically are too big, but they don't really get that they're that big, and so they break things. They're hard on your pets. Some of them are just hard on the pets in the family because they're too big. Their bodies are too big for their age now. They don't manage themselves well in space. I never buy lamps that are more than like, $10. Target has a $7.99 lamp. I've been buying that lamp for many years because we used to go through lamps like there was no, we're always knocking the lamps over. Always bumping into everything. And then yelling at the doorway, like it was the doorway's fault. They're always, or yelling at the table, like, "What? You fell over. Why are you in my way?" I think you've all probably experienced some of that.
Arlita,
Yes.
any ideas when you have the opposite problem, like we have with our one child where he's
Oh.
constantly trying to get rid of everything? Do you just, well, okay, you threw away everything? I mean,
They have a child that throws away every toy. I think because he wants to be an adult. He doesn't want to be a child. It's my guess. That is my only guess about him. And he does like to do adult things.
it's
And-
just a challenge. I mean, I want him to be a kid and I
Yeah.
can take it and store it, but
Yeah.
but getting in the way of getting rid of it, then you are not letting him get the natural consequences that he really has nothing to do either. So yeah, just your thoughts. So.
Well, my thoughts on a child like that are that I would try young toys. I would try baby toys because that's really how old he was when he came to you. And see if he would gravitate toward any, push the button things pop up, even if he would do it for a little while. I don't know if he would. The big blocks, not the small Legos. I don't know if, again, with him, I don't know what he would do, but I would try littler kid toys. I would retrieve them and keep recycling them. I keep putting them back. I keep putting them back. And I have lots of kids that we just put 10 items on a table. And every time they're bored or every time they're just doing, like in his case, if he was doing something adult, I just keep, you can do anything on the table. You can do anything on the table. You can do anything on the table. And in some cases, I've had kids go 2-3 months before they will pick up something off the table. Maybe they'll look at everything on the table before they'll even take something out of the package, but it's all simple stuff. It's like a paint by numbers. It's like, a 4-step. I used to buy these little kits off Amazon. There were 4 steps and you had a monster. They were like felt, those plastic felt things, and you just glued them together and stuff. And they loved to do those. I mean, they did those. I often had those in the waiting room and they could choose to do one of those if they wanted to. Holidays, I gave them a foam egg and a bunch of rhinestones and let them decorate eggs, and we put them up all over the office. They thought that was fun. That they liked to do because they could see their finished product in about 5 minutes. They don't have the patience to do a model and put tiny parts together. I would really try and get him doing something that was 5 or 10 minutes, 3 or 4 times a week. I would just really keep sort of reining him in. Oh, here, you're going to do this for me. Here, I want you to put this together. I want to hang this up. You make it. I would really just, and I think you have to do that with a lot of kids. There are just a lot of kids who move into your home. I call them flitters. They pick up every toy, but they don't play with it. And until we really kind of force the issue, it's terrible to say you have to force them to play, but until we force the issue, if there are other kids in the family, I make that their chore. You're going to sit and play with your brother 10 minutes, 3 times a week. I don't care if you're teaching him to sing nursery rhymes, because that builds cause and effect thinking and sequencing. I don't care if you're got those big Legos and you're just building a wall. I don't care what you're doing, but you're going to try and do it 5 or 10 minutes. You're going to try and play Candyland. Candyland teaches cause and effect thinking. Candyland and Shoots and Ladder. That's why they're kind of early games. And you're going to work at this for the next year. And I think it's often a year before we finally see them maybe doing something on their own. But I think it's, when I think it's either part 4 or part 5, when we look at social skills, we look at the value of play, the executive functions that play builds. I think that is time well spent. I've had a couple of families hire kids in the neighborhood who are like high school students, and they come in once or twice a week and sit and play until these kids can play. And that's been a good job for some kids for years. 12 or 13-year-old in the neighborhood. I mean, they do it till they go to college. And so I just really kind of keep pushing this whole issue. And I've had kids really, finally take to it and get going with it. For those of you who have kids who play, what you're looking for with them is that the play is not all repetitive. Are they doing the same thing over and over, or do they play different things? And if they're only doing 1 or 2 things, then you want to take some of that away and put some other things until they'll play. You want a variety of toys and things that they're doing. In your case, you would just like him to do anything. I kind of try and work some simple arts and crafts, I think, first. He needs to use his hands in a different way, than trying to build an addition onto your house, basically. I mean, like really, literally,
What do you do with teenagers who all they want is their school provided iPad?
Well, I don't let them have it, but that's easy for me to do. Toward the end of the last year we were in our office, I banned all devices from my office. Kids were not allowed to have any devices. And I just they could choose to sit, or they could choose to they could bring something else, or they could play with what was there. I'm not as anti-device as I come off, but if you can't play, then I'll trade you. You're going to do 20 minutes of Legos, and then I'll give you 15, 20 minutes of your iPad, whatever you want. But I'm going to work to build that free play, because I think the skills that come from that can only come from free play. I don't think a device can build executive functions in the same way as playing. I think sometimes you can take these kids to a toy store and see what aisle they gravitate to, and that's kind of a sign of what age they're looking to play with. And then I would buy something from that particular aisle. I found the musical toys very popular. I found the pattern, those wooden blocks that you make patterns out of? They come with You just put the blocks in the, like you start with, they give you a pattern, maybe it's a flower, and you put the blocks in the right places, and then pretty soon you're doing your own geometric design with the blocks. I found a lot of kids really enjoyed those for whatever reason. So I won't, I mean, you can't take the device. I mean, I'd like to take all, if I could take one thing away, I'd take every device away in the after school hours. But I think we can minimize it. And if they have a big tantrum, they're probably going to have one anyway. I'll tolerate the tantrum to get skills eventually. But that's me. I mean, I'm used to tantrums. I lived through lots of tantrums. Kids always scream when they see me, so I'm used to, tantrums. So I think if they have a big fit, we're not going to have therapy. But that doesn't, usually you just get more therapy. And then when they figure that out, they're like, oh, okay, I better stop screaming when I get here. Older kids just whine and complain. Oh, we're going to see her. I hate her. I can't stand it. You can do, I am okay if people go on outings or vacations without the child that can't handle those things. I think sometimes they go and sometimes they don't. In particular, if you have other children, I think those kids need a break. And I think those kids need to be able to look back on their childhood and feel like they have some good memories with their parents. And for kids who really can handle vacation and they go to grandma's house or some friend's house that they like, or some, I'm okay if they have fun there. I'm not about punishing in terms of that. We're going to go do this and have fun, and you're going to go here and have some fun, and we'll be back in 4 days. We'll see you then. I'm okay with all of that kind of stuff. I think that's okay to do. And I think I'm almost done. Right. This is a harder one. Privileges come with maturity. So lots of kids don't get to drive on time. And we tell them you're not going to get your permit. You're not getting your whatever that is, your license that you need before you get your license, your temps. And if you want to, here's why. I write it down. I call it an action plan. Here are the things you need to do. When you do those, we'll be happy to talk to you again. And every time they complain, I go, here's your action plan. Get these things accomplished. We'll be happy to talk about your temps. So I don't just tell them no, I give them what they need to do. I often put it on those big, I have that flip chart size Post-it note paper. I often write it on that. They can hang it up. They can see it every day. And we can just keep, instead of talking so much, I just direct them back to, here's your table with 10 items, you go there. Here's your action plan, you go look at that, you go do these. I'm much more, I just direct them to what they need to do rather than explaining myself and going over things 25,000 times. And then I gave you all a bunch of slides of resources. This, and the only one I'm really going to comment on, there's probably just two, this whole child parenting. There's a whole series. There's this one that's birth to age 5 combined, but there's actually one for year 1, one for year 2, year 3, year 4. And it is probably the most comprehensive synopsis of development. Like if you didn't have your child the first 3 months of life and you want to know what they missed, that book will tell you what they should have been doing, like day 1, day 2, day 3. I mean, like really as a baby, you're supposed to look at patterns. And most cribs, most of those bumper strips have patterns, and they're all black and white because, you're not really using primary colors for a while there. But those patterns lay the foundation for a lot of math skills. You have to be able to recognize patterns. So even if you missed a few weeks with your child, you're missing some foundational things that you can go back and give them. So it is truly the most comprehensive look at child development. I mean, they put a lot of effort into those books, and they really are extremely valuable sources of information. If you want to know what your child should be doing, if you want to know what your child missed in the time you didn't have them, that's your series of books. Toddler Adoption is a book about development of specifically adopted kids who had trauma. That's Mary Hopkins' Best. And this one here, this book, The Boogeyman Exists and He's in Your Child's Back Pocket, probably the best book on social media that exists. And this woman speaks constantly. She's actually been in our area. She's actually been to the Revere High School for people who are over near there. She'd probably be back. But if you want to really understand the dangers, the types, if you're not familiar with the dangers of social media, or you think you are, even if you think you are, I'd read the book. And she gives a lot of recommendations and a lot of safety tips. And I don't think you'll find what she has put together anyplace else, or I have not found what she has put together anyplace else. And this other book on this slide, I think, is one of the best kids books. If you have kids, even if they're older, even if they're adolescents, I think this book is still very usable, about pornography and why they should not be on pornography and how to help them. But it's really designed for kids. And the best one that there's not that kind, there is kind of some, but they're not all that great. And I think that's, and the other ones are all pretty self-explanatory. These little books here are all moral dilemmas. It's like a paragraph. So if you're riding in the car, you can throw one out and everybody takes a turn saying what the right choice would be, what you should do in that particular situation. But I think they are helpful for kids with moral development that's not on track, to think about what really you should be doing. Not to say they're always going to do it, but at least to get them saying what they should be doing, I think is the first step to actually getting them doing it. And then these are about empathy and empathy building. And then the parenting with love and logic, the foundation of love and logic, the big point of love and logic and all of their materials is it's natural and logical consequences, delivering them quietly, just letting them happen and not saying anything, just stepping back and allowing them to happen. And in this day and age, Love and Logic has books, webinars, they have in-person classes. They're very funny speakers. They're very entertaining and very knowledgeable. They've got podcasts, they've got DVDs. However you like to learn, you can learn Love and Logic because they have a format for everybody. That is the end of my PowerPoint. And I don't know if anybody would like to ask any questions or make any comments. Some of you have been very quiet. You can talk now if you'd like to. You're too quiet.
We'll need to work on an action plan for the driver's permit.
I think so. And probably an action plan for your daughter who thinks she's going to have the car more than you. That might be a solution for her. You know, she just thinks you're going to, like, basically, I think you're going to walk and she's going to drive is what I think. So you've got one of each. You have one that really isn't ready to drive and one that is just trying to figure out how to get the car all the time. So she can drive every place she wants to go the day she gets her driver's license.
We're down to one car. So he had to walk home yesterday.
Well, hopefully we'll get more chips soon.
Yeah.
And
Yeah.
everybody can get the car they need.
Yeah, he had to walk home yesterday, which was rather funny.
Your son had to walk
Yes.
home. Oh, good, good.
Yeah, I told him you could ask someone for a ride or you can walk.
Right, good.
We were both at work.
Mhm.
I can't leave when I'm at work. He can't leave when he's at work.
Well, he's not very respectful either, so. I only like giving rides to people who are respectful. So it's good. Maybe that's why he was a little better in therapy today. His brain got a little, activity going there. Anybody want to ask about a specific behavior? No. Yes.
What,
Go ahead, Jim, who joined us.
sorry for being late. So
Okay.
the recommendations that you
We're not keeping track, Jim.
okay. So the recommendations you were making about with the driving, is that largely applicable to Elijah's nowhere near to being a driving age, but like with cell phone. I know he's been wanting a cell phone, and we're pushing that off until we hope until he's 13. So that's 3 years from now. So like, but largely we can still follow the same sort of, I won't say give and take, but the recommendations you were making with the driving, like moderation, limitation, how it still applies similarly, right? Would that be?
Well, yeah, I mean, I'm a firm believer in cell phones at no sooner than 14,
Good, okay.
number of reasons. I mean, I think that's, and I certainly have clients who are not mature enough at 14 to have a cell phone. I think that sometimes we wind up giving them phones because they're in sports. They have to be able to tell you they changed their field or they practice was late or whatever, in terms of that. There are now what they call the cell phone light. I was mentioning this to somebody else today. It does nothing but make calls and text. It does not go online unless the person who owns it makes it go on. It can go online, but it is now a phone. It's hard to get a flip phone now. They don't make many of those anymore. So this is kind of like a middle ground. It's activated through your phone plan, and you will have a plan for your calling and your texting, however many, unlimited or whatever you want, but it does not go online at all. It will not pick up any other Wi-Fi unless you specifically may allow them to do, ask for that. And it would be the one person who is registered with the phone. So it's not like your child can call either and have it activated. So I have a family right now that has 2 of those. It's really going very well. The kids are annoyed by it, but it's going very well for the parents because there's nothing to lock down that we are aware of. And the kids themselves have been complaining they can't do anything. So they must not be able to figure out any way of making it do what it's not designed to do. And so I think in a few years, I think you won't have to worry as much about some of the devices. There's enough of apps now that you can shut them off. There's the apps now where you can run every text message that they are texting. You can see everything they're doing on their phone right on your own screen. So I think there's more available. But I'm a firm believer that you really should have a phone when you are capable of having a phone. Unfortunately, in this day and age, I feel like there's also, there becomes the issue of we want them to be social and we want them to be friends with good people. And in this day and age, if you can't text, you're really out of the social loop. So there's a lot of issues there, but I would almost, hope that maybe something like this cell phone light, they'll still be in the texting loop, but they won't be able to do anything other than text. It won't send pictures. It's not going to do that kind of stuff. They're kind of worth looking at. I mean, they're new now. They're not as sophisticated as they will be, but I'm really hoping it solves some of our cell phone issues. Truthfully. Were you Googling it, Peter? Did you see it? Yeah. And I think pretty soon all companies will have one. And
did you say it was Gab?
I didn't say what brand it was. I just said it was a cell phone light. LIT, I think they're calling it a cell phone light. I think you can just Google cell phone light and it comes up.
Because I found another one. It's called Gab Phone Z2. It's very similar. It cuts off all internet. It looks like a regular.
Yes, they look like regular phones. Some kids, I mean, we want them to be, it's hard to be normal if you don't have normal things. And so it looks like they have a phone. And so they can look normal. I mean, we can only make them so abnormal. I think for each case, that's kind of unique to figure out some of those factors that go into that.
Yeah.
But we want them to move forward and fit in, then we have to let them go do some normal things. We can't keep them from everything as much as we'd like to. And driving, I will just say, driving varies. I have kids who all they do is talk about getting their temps. And then when they turn 15, you never hear another word. And I would say the large majority of my clients, when they're 18, it's the parents dragging them off to the motor vehicle department saying, you are going to drive. I am done driving you. Like, hello, you've got to get your license. A lot of my clients will not make the effort to get their license. So often we don't even have to worry about it. I think, except in your case, you do have a son and daughter, I think, who are serious about this driving thing. Peter put a link up for everybody, the light phone. Like a lightsaber, maybe like a light phone. We have a light phone now. So that's my best thoughts on that.
That's where the-
And I mean, whatever whatever you give, you can always remove.
Yeah, there was something about those, like they were, the service wasn't great.
I didn't hear whatever was said. So.
Oh, we were talking about the Gab phone. We had looked at those,
Mhm.
and there was something, it was okay, but then it
Yeah.
wasn't. It was, there's a lot of negative feedback saying it was coming in and the service wasn't working.
Mhm.
And so it was kind
I
of
think, yeah, they're pretty new.
fighting
on
more
the
with the service.
Right. They're pretty new on the market. My guess is they'll just get better and better.
There were some,
Yeah.
I had heard of other light phones,
Mhm.
and those were relatively new and they were really pricey. So
Yeah.
we've gone with the flip phones.
Yes. Not as
That's
pricey
what-
as getting an attorney, however, when your kids get caught, with, we're not, with
Right.
sexting issues and whatnot.
Yeah.
There's always
know-
that aspect of things, no, but they are a little pricey, but for peace of mind, I thought they might be, if they want it, they can earn the money for it.
Mhm.
I don't know how many people have teenagers or older kids versus younger
Several
kids, but
here, several have
um,
youngers, yeah.
I think the best, we have a 15-year-old and an almost 17-year-old, and the Apple products now are so much better than when they were like even 3 years ago. The screen time apps are so much better. Like when they did one of those upgrades a couple years ago, now you really can you can just take the Safari internet search completely off the phone. So you can just make it into a regular phone. You just take that app off. Like,
Yeah, they're getting
you
very
know.
sophisticated in terms of trying to shut down.
Right. I wish that
The
would have been
problems.
available. Right. We didn't let our kids get phones until they were 13, which sent they were like literally felt like they were the last kids on the earth that of their friends that didn't have it. But and to be honest with you, I think they were. I mean, it's just ridiculous how young kids are when they get in their phones. But I do think the Apple screen time, if anyone's interested in it and you're not looking to spend a bunch of money on buying a phone and then having to replace it again later, do whatever. I've become, unfortunately, out of necessity, a nut job in how to restrict phone use. And the Apple products are much more helpful than they used to be a couple of years ago.
I think by the time an adoptive parent launches their child into adulthood, you really should just get an honorary IT degree
Mm-hmm.
and be able to be an IT person because you have
Mhm.
learned
Mm-hmm.
more about security measures than most IT people
Mhm.
truly know in a way, or as much.
I've confused.
Many of you are equal.
I've confused two Apple tech support people.
I
Yeah.
think that should be a sticker.
Those of you who have younger kids, you want to
Thank
start.
you.
You want to start looking now so that you are ready for when you have to give them a device.
Mm-hmm. Mm-hmm.
You too will have these issues.
Mm-hmm.
So is the iPhone 8 within that realm of technology, or does it have to be even newer?
No, I can tell you that just because I got rid of we just had the 8 will work. Mhm.
Okay.
I don't know which iOS it is that was the update. Forgive me. I don't remember that. It came out a couple years ago, probably at least 2 years ago. So, but I can tell you that we just got rid of an 8 for our teenager, and it worked on that.
Right.
Okay.
So you'll be talking like her. I don't know what iOS you have or which one, but you'll know what all of that means.
Yeah.
You will. You'll just be, you'll be. Right. There are several people here of adolescents and several people here of younger children. It's a mix tonight. It's a mix also in terms of domestic and international. So, anything else?
Arleta, I was just wondering with the older teens,
Yes.
some of the activities that you feel are still beneficial for them for the cause and effect thinking. I mean, you mentioned the larger Legos and things like that, but as far as arts and crafts and things like that, some of them more beneficial. And you did mention the wooden patterns too.
Mhm. Anything that is a sequence, anything that requires them to do a set of steps.
Okay.
Sequencing will lend to cause and effect thinking. I think most of it just comes with the older kids by just letting them forget things and fail at things. I mean, I don't really like to say let them fail at things, but I think if we all look back on our life, some of our best learning experiences have been failures. Most professional athletes will say their failures were lent to their success and stuff like that. But I think anything that they would be willing to do, I don't know if you took them to like a toy store, what they gravitate to.
Yeah.
Board games where they have to strategize a little bit because that's cause and effect. You're trying to predict the outcome of your move in comparison to other people's moves. Even if they would play, I mean, I'm big on board games. I really am big on working them up to more sophisticated board games. I think you learn a lot of skills with board games. And I mean, I've had people play Uno one-on-one with their child for a long time before they can play with one person nicely. And then we add a second person in the family and we go back to work on learning how to play with 3 people. But that really is all your turn taking, learning how to lose gracefully kind of stuff. And then once you can, and then you work up to harder games with a little more strategy. But I think when you have to strategize, you have to really think about, if they do this, what will I do? I mean, Scrabble kind of requires some strategy. Anything that requires some strategy, I think is good. But I think arts and crafts where they actually have to start something and go through the steps and finish it. I followed a sequence, I got a product, an end result in terms of some, I did this myself. And even if their first efforts aren't, we're going to tell them, oh, that looks great. I'll wear that scarf. Thank you. Whatever they make. But I would be curious what they would do. I'm not sure what are yours capable of doing in terms of, do your kids play board games?
Yeah, Zach does. Mia gets very frustrated and angry. So yeah, I'm wondering more for her because she's always angry about everything. She can't finish it because she gets so angry.
Well, then I think you have to we're going to play whether you're angry or not, Mia. Sometimes I just recommend playing, like, we're going to play for 15 minutes. We're not playing until there's a winner. I have 15 minutes right now. We're going to sit down and play this board game. We set a timer and we're just going to play until you can play nicer. We're going to play this way until you can play. I don't tell them that because once you tell them what your goal is, then they're going to sabotage. I never tell them in advance anything I'm doing. But really I'm trying to work you up to 20 minutes. Can you play nicely? Then can you play nicely 25 minutes? I mean, everything I think is very incremental and requires a lot of practice until you can get kids to higher levels of skills. But that would be true if it was developing, if your development was developing normally. You don't go from Candyland to Risk in a year. You go in a long period. So it's not, and for us, it's like we have these older kids and we want them to catch up. Most adoptees, here's the bad news, they don't leave home until they're at least 23. So you really have not until 18, but you have until 23. Everybody's like, oh, well, now everybody like, oh. Because they're not really their age, so they don't leave They don't leave as soon as other kids. So you actually have a little extra time to work with them and work on things and try and get them someplace.
When they're socially and emotionally that little,
Yes.
and they're chronologically, mid-teens, what can what level of expectation can you have for doing the daily tasks? Like, are they going to be doing them at a teenage level or at a toddler level?
Well, my goal is they're going to do them the way you want them done. And I will strive to make that happen. I will use a lot of natural and logical consequences to get the room. If we're going to pick getting the room clean, I'm going to work at that with you until we get that pretty much the way you want it.
The room
know,
itself doesn't bother me.
But if you want the dinner dishes done, or you want, more whatever you want in terms of some of the vacuuming and stuff like that, I will work. I'll be giving rides to people who vacuumed correctly. And I hold firm to that. Again, I won't make it if I'm going to say that, I'm going to mean it. I won't say it if I don't mean it. So if you have to give them the ride, don't say that. But
No,
I'm only doing this for people who've done it. And then I don't let them run around in 5 minutes and get the vacuuming correct. You're going to wait until the next day. I'm not going to play that game. I'm not going to allow you to run around and do what you were supposed, that you've had 3 hours to do. We're not going to do that, because that will just become the next battle. You're going to do it every day the way I asked you to, and then I'm going to do for you. You are going to do for me, and I'm going to do for you, but I'm not going to keep doing for you without you doing. I don't expect a crappy job. And I do think a lot of kids are capable of sweeping a floor or vacuuming to a decent degree. Dusting.
Yeah, and I don't think, maybe I didn't phrase my question correctly.
Mhm.
I'll use my example because I gave up laundry for
Yeah.
them.
Yep.
And so I truly don't care if they have clean clothing or not.
Good for you. I don't
It's
either.
just that his tends to sit for weeks.
Mhm. Oh, I bet it's ripe.
It's
I get-
pretty nasty.
Yes.
But that being said, he's capable of doing it at the level of a 3-year-old or a 15-year-old. That's my question.
Mhm. I think he's probably capable of doing that reasonably without breaking your washing machine. I would actually think he's probably, because I also look at what he's capable of doing for the neighbors.
Mhm.
And that is the equivalent of being able to get your laundry in
Mhm.
and get your laundry to the dryer. And at the office, when we were at the office all the time, all of the kids, a lot of you do live with kids that have a lot of body odor, won't take care of themselves. We'll talk a little bit about that when we do I'll talk about self-concept in one of the later sessions, and more about the social skills in one of the later ones of these meetings. And I used to just Febreze them. I used to just spritz them with some Febreze when they came in for their appointment. And often they would come to the next one and and I showered today. Like as though they were showing me, like, there, I got you. I'd be like, oh, good. Like, kind of walking away, going, thank goodness. Can't take one more, one more set of feet that are like, I've already seen 6 kids today that smell. You're my 7th. Thank goodness somebody showered. I had a dog who just wouldn't leave them alone if they really smelled. He would just root at them and root at them and root at them. And and I let him. And they would come in and they would tell him, they would look at the dog and say, and I showered today. And like as though the dog comprehended, but I would walk away laughing from that, because like they were going to show that dog, you won't be able to sniff me today. But I used to laugh sometimes till I had tears because, that dog just wasn't going to leave them alone. So, but I think, I do think he can do his laundry. Good for you, though, letting it go. You get a sticker too today. I owe you and Peter stickers today. And I owe Janet a sticker for her tech support during the session. See, when I was having a little trouble with my PowerPoint, I didn't know I could have just called on you to help me with it. All right. Well, we'll be back in a week. And we're going to look at another aspect of development and what we can do about that. Okay?
Arlita, can I just clarify? Are we gonna
Yeah.
tack on the one that was
Yes, we are.
postponed? We're just gonna
Yes.
put that one more
Yes.
week on.
So I should have put a break between the two, there's a group following you. And so I'm going to email those people and ask them if they would start a week later.
Okay,
And then if not, we will just flip a coin and pick a night.
okay.
And I'll just do like 2 in 1 week to finish the group.
Okay.
Or I'll just do the last one on a different night, if that's okay.
Thank you.
So I've learned there now to put a gap week in, but I plan on having COVID again. Well, thank you all for coming.
Thank you.
Some of you I'll see between now and the next group, and some of you I'll just see at the next group.
All right, thank you.
Thank
All right.
you.
Good night.